Asherman syndrome means intrauterine adhesions or intrauterine synec, and the most common cause of this Asherman syndrome is vigorous curettage. So when vigorous curettage is done, the basal endometrium is destroyed and there will be a raw surface which can lead to adhesions. And the highest risk for Asherman syndrome will be curettage for PPH. PPH is postpartum hemorrhage. The other risk factors for Asherman syndrome includes multiple MTPs, dilatation and curettage, genital tuberculosis, schistosomiasis. The clinical features of Asherman syndrome includes menstrual irregularity, where secondary amenorrhea is more common than hypomenorrhea, followed by infertility, followed by recurrent pregnancy loss, followed by dysmenorrhea. And the most common presentation in case of Asherman syndrome will be menstrual irregularity, followed by infertility, followed by recurrent pregnancy loss, followed by dysmenorrhea. And there will be infertility in Asherman syndrome. So to rule out infertility in Asherman syndrome, HSG or USG can be done, but USG is not a good modality for intrauterine adhesions. So HSG shows multiple small irregular filling defects which are suggestive of Asherman's syndrome. The investigation of choice will be hysteroscopy, diagnostic and therapeutic. Treatment for Asherman syndrome is therapeutic adhesiolysis, but there will be recurrence. And regarding investigation, saline infusion sonography can also be done in case of Asherman syndrome. So saline infusion sonography is the superior most investigation, followed by HSG, followed by USG. So the treatment for this Asherman syndrome will be therapeutic adhesiolysis, but there will be recurrence. So to prevent adherence, adhesiolysis is done where we have to give high dose estrogen for 1 cycle after hysteroscopy, plus intrauterine pediatric Foley's catheter is inserted. And the last resort for infertility treatment in Asherman syndrome will be IVF plus surrogacy. And hormone profile shows that all hormones are normal, and karyotype will be completely normal, phenotype absolutely normal, and PCT will be negative.